Joyce. My name is Kristen and I'm a physical therapist. From the history you gave, you significantly strained your left quads, or probably both quads at the time, by doing plyometrics training, and it's been about a year later and you still feel this consistent tenderness over your left knee. What happens when we do a lot of exercise and kind of overdo it, and it sounded like you did it a few days in a row by doing plyometrics training. Plyometrics training is very good, but you need adequate rest and to slowly work your way into the intensity that you may have been doing. What a lot of plyometrics is an eccentric contraction, which really rips up or tears the muscle, which if you allow appropriate time to build up, it actually is very good in strength training and speed and quickness and being able to jump high. So it's a very effective training method, but it needs to be graded, and you go into it at a slower pace. So since you're dealing with this injury now, you've described a consistent tightness over your left knee. What happens when we do overdo it, we get little micro tears in the muscle. And sometimes if that inflammation sets in and stays there too long, or you can actually get some scar tissue build up with a chronic injury like yours, and that can cause the stiffness. So one of the things that's the best for addressing that is to do just a massage. You can go up and down in the direction of the muscle fibers, and you want to apply enough pressure that you feel pressure, but not necessarily pain. It doesn't have to be really deep at first until the pain level comes down. And then you want to also do cross-friction massage and go across the muscle fibers in this direction. I'm showing you on your left knee is what you said is the most painful, but if you do have it on the right knee as well, a good massage therapist or a good physical therapist can help work this out also. Then once you do some of the massage, the next thing that's a really good thing to do is to just stretch the quads. One of the simplest stretches to do is to stand, hold on to something for balance, and you're going to just grab your foot, and the key to this stretch is to get your knee pointed towards the floor, because then you'll feel it. Some people do it like this and you're not addressing the hip component of the quads. So you want to kind of tighten your glutes, get your knee pointed towards the floor, and pull up on your foot. And I'd like you to hold the stretch for 15 seconds, then release it. Do it on the other leg, holding it for 15 seconds, and do 3 stretches on each leg, once, or sometimes if you need to, twice a day. That's going to really help loosen up and bring some of the elasticity back into that muscle. Then you had said that you massage your back and sometimes you feel the stiffness in the left knee because you also have back problems. I would need to know a little bit more about the back problems to really appropriately address that, but it sounds to me there's a nerve component to your injury, and one of the best nerve glides that is just a general nerve glide, calming, and it also helps with the mobility of the back, is the cat-camel stretch. So I'm going to show you that. But the key to this is you want to stay out of pain. You want to do a smaller range. If a larger range of motion causes pain, you want to just shorten that range and go through the pain-free range of motion. And you'll notice that your range continues to increase slightly. So this will be a good exercise. It's very gentle, very mild, but it'll address the nerve component of the back as well as improve your back mobility. So for this exercise, you get on all fours, your hands and your knees, and you're going to rock both directions. You're going to drop your back out, down, and bring your head up. And then you're going to go in the opposite direction and arch your back and bring your head down. And you're going to just do this rhythmic motion. Again, staying within pain-free ranges. And this will really loosen up both your back and mobilize and glide the nervous system, which is probably a component of what you're dealing with. And I'm going to have you do 10 to 15 repetitions, depending on how pain-free it is. So the key is to stay out of pain and slowly work into those exercises. If you have any further questions, please feel free to contact us. Be well.